Good day to you out there. I still remain your head instructor and blessing. Today we are going to look at a very important health topic, urinary incontinence. This is a common health condition no one wants to talk about, and because of the stigma that surrounds it, many people feel too humiliated to seek help. What exactly is urinary incontinence? Urinary incontinence is the unintentional passing of urine. It means a person cannot prevent urine from leaking out. In other words, a person urinates when he or she does not want to. This happens when the muscles in the bladder that controls the flow of urine contracts or relaxes involuntarily, resulting in leaks or uncontrolled urination. This condition may be temporary or chronic, and it occurs much more often in women than in men because women have a shorter urethra than men. There are various types of urinary incontinence. The first one is a stress incontinence, which happens to be the most common of all. There is the leakage of urine when the bladder is under pressure. It is triggered by certain types of physical activity. For instance, one may lose control of his or her bladder when he or she is laughing, sneezing, coughing, or exercising. These activities put stress on the sphincter muscles that holds urine in the bladder. It occurs very much often in women due to pregnancy, childbirth, or menopause. The second one is the urge incontinence, which is also known as the overactive bladder incontinence. This occurs when one loses control of his or her bladder after experiencing a sudden or a strong urge to urinate. Once that urge hits, the person might not be able to make it to the toilet in time. It is caused by the overactivity of the detrusor muscles, which controls the bladder. The third one is the overflow incontinence. This occurs when a person is unable to empty his or her bladder completely and it overflows as new urine is produced. It is caused by an obstruction or blockage in the bladder, which prevents it from emptying itself fully. It is often found in people with diabetes or spinal cord injuries. The fourth one is the functional incontinence. This is when urine escapes due to a person's inability to get to the toilet in time. It is caused by physical or mental barriers which could prevent one from making it to the toilet in time. And this can be due to cognitive issues like stroke. No, this can be due to cognitive issues like dementia, which is also loss of memory, muscular issues such as arthritis, or neurological issues such as stroke or a spinal cord damage. It is usually found in the elderly or disabled people. The next one is the total incontinence. This is when the bladder cannot store any urine at all, which causes one to pass urine constantly or have frequent leakings. It is caused by a problem with the bladder from birth, a spinal cord injury, or a fistula. A fistula is a small tunnel-like hole that can be formed between the bladder and the nearby areas. We'll talk more on that in our subsequent videos. The next one is the mixed incontinence. This is when one shows evidence of more than one type of urinary incontinence. Having looked at the various types of urinary incontinence, we're quickly going to look at the causes of urinary incontinence. 1. Age. As one ages, the muscles that support the bladder tends to weaken and may lead to urinary incontinence. 2. Damage to the pelvic floor muscles that support the bladder through pregnancy, childbirth, and a certain type of surgery like the hysterectomy, a surgery which involves the removal of the womb, can also lead to urinary incontinence. Enlarged prostate gland in men is another cause of urinary incontinence, especially for men. Treatment for certain type of cancer, like the prostate or bladder cancer, can also make it difficult for one to control his or her bladder. Constipation is another issue that causes one to have bladder control issues. Urinary tract infection is another cause of urinary incontinence. Kidney or bladder stones can also lead to urinary incontinence. Then, side effects from certain medications such as blood pressure drugs, muscle relaxants, sedatives, and some heart medications can make one have urinary incontinence. Lifestyle factors like taking too much alcohol or caffeinated beverages can make one have temporary bout of urinary incontinence. Quickly, we're going to look at the steps taken to prevent urinary incontinence or the prevention of urinary incontinence. 1. Maintain or keep a healthy weight, as this helps to reduce the pressure on the pelvic floor muscles. 2. Get enough exercise, especially pelvic floor exercises which strengthen the pelvic floor muscles that support the bladder. For instance, Kegel exercises. 3. Avoid irritants to the bladder by limiting alcohol and caffeine intake. 4. Drink enough liquids daily, especially water. 5. Avoid constipation by eating plenty of high fiber foods such as whole grains, fruits, and vegetables. 6. Seek prompt treatment for urinary tract infections or bladder infections. And 7. Go to the toilet when you need to go to. Go to the toilet when you need to go to, as regular holding in of urine can wear out the bladder muscles and may lead to urinary incontinence. And quit smoking if you do smoke, as it raises one's chances of developing stress incontinence. Remember, urinary incontinence itself is not a disease, but it could be a symptom of an underlying medical condition. So seek help if you experience any of the aforementioned types of urinary incontinence. Your health is our concern. Stay safe. See you in our next videos. Bye.
Angel Sports Broadcast is much more primarily interested in refreshing your minds with news and information on health, politics, and religion. We solicit your support with your subscription, comment, and suggestion. Thanks for watching, and we do hope you're better informed on this topic or emphatically informed.